The President.
Good
morning. The Council resumes. Debates on motions with no legislative effect. The motion debate on requesting the government to set up crisis support centers for sexual violence victims and abused children in public hospitals. Members who wish to speak will please press the request to speak button. I call upon Dr. Pierre CHAN to speak and move the motion. President, I move that the motion as printed on the agenda be passed. The number of sexual violence and abuse of children has been on the rise, and therefore my motion seeks the administration to set up crisis support centers for sexual violence victims and abused children in public hospitals. The purpose is to arouse the public's concern for victims and to enhance support for them. My speech will be divided into 5 areas. Why would I want the administration to set up crisis support center for these victims in different areas? On the 30th of May, Storm Lily announced on that day that in between 2000 and 2017, there were 3,501 cases for requests for sexual assault and rapes. The number of cases rose by 116% in 2017. And then there was also the Me Too action involving victims in overseas in Hong Kong and artists and also the field and track athletes. And they were strong enough to come out to tell us their unfortunate adventure. And in Hong Kong, we only got 24-hour one-stop service in Prince of Wales Hospital in the NT. And this is not government funded. It's just provided by an NGO. And for other A&E departments of public hospitals, the support for such victims is also precious little. And such victims, they will be treated like any other patients seeking help at A&E department. They have to be subject to the triage arrangement. All right, if the victim is willing to report a case to the police, the doctor will refer him to police post at A&E department. There is no dedicated room for videotaping and for statement taking. And some victims said that they would just be taking statement or giving statement behind a curtain. And then the police would then decide whether forensic examination should be done, and the doctor will decide whether hospitalization is needed. In the whole process, the victim has to repeat again and again the painful experience, and this is adding to the trauma she has faced, and that may also affect her decision to report the case to the police or not. According to the EOC, according to the Joint Conference on Equal Opportunities for Women, in 2013, well, for 1 in 7 women in Hong Kong have been subject to some sexual violence, and then 7.4, every 7.4 hours there is such a case happening, and only 49% of those claimed victims have a report. Less than 3% of them have reported cases to the police. There was a victim, Alice MAK, and she pointed out to the media that she was asked to give statements 5 times, and she was referred from the report room to the serious crime division, and she had to retell her painful experience so many times. I think that is one of the reasons why the reporting rate is so low, because of the complicated procedures. In the UK, Australia, Malaysia, Taiwan, and also Thailand, and even Sri Lanka, they have a 24-hour one-stop service, a crisis support service for victims of sexual violence. And it is said that after such a center has been set up, the reporting rate in Malaysia has gone up. So I propose that the administration provide extra resources for the hospital authority, and according to the guidelines for medical legal care for victims of sexual violence published by the WHO, we should provide 24-hour one-stop service for victims of sexual abuse, violence, and children affected, so that they can have a high degree of privacy, and in a protected place they can receive treatment and follow-up services. They can receive a forensic examination, report to the police, provide statement, and there should be video taking facilities, and then they can be helped and supported by social workers, and then we can alleviate the fear and psychological stress on victims, and then they can be more willing to report such cases to the police. And on the 27th of June, I questioned the Secretary for Security, and it was exposed that the administration has not compiled separate statistics on cases of rapes and indecent assault. And then, meanwhile, there was also no overall statistics for victims of rapes when they gave a police statement at public hospitals and for forensic follow-up. If we don't even have a proper set of statistics, how can we formulate effective measures and policies to help the victims? I urge the administration to set up a interdepartmental reporting mechanism and to keep proper statistics of the victims concerned. According to the Social Welfare Department, in between 2015 and 2017, there were 2,740 reported cases of child abuse received. In the first half of this year, we've got 554 cases already. These vulnerable children, well, they really need our attention, because 60% of the perpetrators were parents of these children, and even relatives, and also step-parents, stepfathers, and grandparents, and their carers. Over 80 to 90% of the perpetrators were relatives of the children concerned. And how can we send a child back to their families, given that 9% of the perpetrators are family members, and therefore we need a one-stop crisis support center to alleviate their fear. Now, when a school teacher or social worker identify a case of a suspected child abuse, the child will be sent to the A&E department or the pediatrics department of the police, because there is nowhere else to place the child. And on the policy of interdepartmental coordination for such cases, there is no holistic arrangement, and the whole concept is very fragmented. The SWD passes the buck to doctors, to frontline social workers, the police, teachers, and psychologists, and there is not overall coordination, and they are very passive in this regard. I have a lot of grievance in this regard. Many cases of many suspected cases of child abuse have got the children stuck in the hospital waiting, follow up by the social workers, and so they may be hospitalized for 2 weeks to even a few months. And this is so-called interdepartmental cooperation. There is no flow of communication and synergy and cooperation at all. Well, one day in is too long in politics, and hospitalization for 1 day is also too long. When children are stuck in the ward, then the risk of contracting flu and pneumonia and gastrointestinal diseases would rise. If we have a one-stop crisis intervention center, we can lessen their exposure to risk of infection, and we can also alleviate the workload of healthcare workers and on the need for hospital beds. And then I hope the administration can streamline the procedures for sending such children to shelters, and so that we can all play a part in helping the patients. Now, even one case is one too many, and these children are not just statistics. Well, there are a lot of pain and problems behind them, and we must need pediatricians and also frontline social workers to help to further understand the core problems of the family. I suggest the administration provide more manpower for pediatricians and social worker and also childcare workers, so that we can give timely assistance to these vulnerable children. And according to the SWD, in the past 5 years, and there were over 30% of the sexual abuse cases involve children, and for the male victims in 2013 rose from 4.5% to 8% in 2017. I think the reasons for these cases are very complicated, and different genders and sexual orientation, age groups, and also there might be a transgender and handicapped victims involved, and they might, because of social values and family and religious and cultural background, find it difficult to retell their painful experience, and therefore they need professional and dedicated support, and we need to enhance the awareness and sensitivities among doctors, the police, teachers, and social workers. And I'd like to turn to ethnic minorities. Because of the language barrier, they may not be able to retell their suffering or their experience very carefully, and we need translators to provide interpretation service in a professional and impartial manner, so that there can be accurate interpretation for the victims. With these remarks, I beg to move.
I now propose the question to you that the motion moved by Dr. Honorable Pierre CHAN be passed. 3 members will move amendments to this motion. The Council will conduct a joint debate of the motion and the amendments. I will now call upon the members who will move the amendments to speak in the following order: Hon Alice MAK, Hon Ka-chun, and Dr. Fernando Chang. But they may not move their amendments at this stage. Hon Alice MAK. Madam Deputy, last year there was the emergence of the Me Too movement. This global movement have made a lot of victims dare to stand up to share the experience of being sexually molested. And even though Hong Kong is an international city, due to traditional influences, when it comes to sexual molestation and domestic violence, it comes to a weather backward. And from not only the physical abuse, they have to recount the experience time and again, and their privacy infringed and led to the repeated re-traumatization. If the victims come with disadvantaged background, for some children, the grassroots, or the ethnic minorities, there are problems in the handling will be tougher. As for today's motion amendments, in urging that in public hospitals to set up a crisis support center for better children and spouses, the FTA of support, hope that they can step up the strengthening for the support of these issues. Not only would have affected victims, also be lifelong implications. I hope the government can apply sympathy in dealing with these issues. According to Census Department and SWD, every year there are about 3,000 new spousal abuse cases, about 1,000 child abuse cases, and 1,000 new sexual violence crimes. And for the sexual violence reporting, there's a rising trend. These cases, and every day there are dozens happening every day. And for the hidden or those involving family members on how to heal the wounds and how to make them to tell the story to law enforcement officials, an important issue. And this the victims are already affected at these levels. To get them to recount the experiences, that will be incredibly heart-aching for them. I understand over the past decade or so, the SWDHA and the police and on the support of domestic abuse and sexual violence and children, and to review procedure time to time. And the frontline staff have reflected these arrangements are unsatisfactory. There are a lot of victims who are troublesome and are humiliated, and stop the reporting procedures, actually encouraging the perpetrators and aggravating the pain of the victims. And in order to offer more support and, for example, offering one-stop service, and they would definitely better for these disadvantaged victims. In my memos, I mentioned that we should set up a special investigation team dedicated to handling cases of sexual violence and child abuse. I believe that I'm not the first one raising this proposal, but have not been heeded. According to frontline social workers, take indecent rape cases, for example, and after the victim went to the hospital, they need to tell the uniformed officers, the detective teams, and all the forensic division to count the experiences. And they could maximum tell the stories 5 to 7 times. And on judicial proceedings, they'll be asked more than once. And the psychological re-traumatization is plain to see. Thus, our members have proposed to the government would have the special investigation team and department, and for the police investigation to provide greater convenience. And we need to set a one-stop crisis center. Upon reporting cases to be assigned to the profession teams to refuse the times of recounting, and not need the victim to go to the police station to statement taking, and appoint experienced staff with relevant training to take over the cases. According to the police forces, and under the police, they have the policy unit on the family unit and sexual abuse. There's a policy formulation and work with other departments and NGO and liaise with them and to support the relevant training. And yet they have no teams on detecting the relevant crimes. And for some special cases where those commercial crimes and online crimes and missing populations, and more recently, these telephone scams, the government had dedicated teams to focus on investigation and handling. As for child abuse and sexual violence, to set up a dedicated task force is nothing new and difficult. I hope that the authorities can look into it, and these cases are happening every day. Why do we need to one-stop and lead by the police? If we consider a victim after being assaulted, they need to report to the police. They need someone he can trust and in a safe environment, and where they were free from humiliation, where they can retell the whole episode. We need to be worried about the experience every time, and the setting for statement taking is just only behind a curtain. How can the victims be assured to recount the experience in full? A lot of the victims, reflected by frontline social workers, in the midway, they have gave up reporting to the police or seek legal recourse because they don't want to retell the experience. It seems we're encouraging the perpetrators. Is this something that society want to see, to let the perpetrators off the hook and continue to bully the women? Another major proposals amendment will be on interpretation services. I have mentioned this a lot in the lecture, especially the public hospital interpretation service is as good as none. For the ethnic minorities, have created lots of inconvenience for them. If where domestic abuse and sexual abuse is concerned, and for the handling, there will be a disaster at the public hospital level. And the local EM population, there's about 0.26 million, made up of about 3.6% of the total population. In Hong Kong, there's about 60 resident medical interpreters, and most of them on a part-time basis with high wastage and insufficient service is universally acknowledged. And if you go to the HA Hospital Authority website and the Hong Kong Public Hospital, the interpretation is not on call and up to clock, and all the emergency cases and only done through telephone. And for those who need careful examination or statement taking for the sexual and child abuse cases, they will lead to a lot of inconvenience. And for the victims, they will felt more helpless. A deeper issue is that some of the EM groups, a lot of them, they are well know each other in the community. So these interpreters are not resident interpreters and don't serve on the part-time as need basis in public hospitals. And for the victims, whatever the not know the interpreter victims on the scene, you can't ensure that interpreters may know the victims' real friends and relatives. And we know that the tight-knit traditions of these communities, we need a full-time medical interpreters hired by the HA to provide a professional interpretation service, especially during statement taking to ensure the privacy of these victims. We also need the victims to be assured. In lots of cases, some of the EM women, even though they encountered health issues or sexual violence cases, when they see the medical interpreter, for example, is on their part-time basis, they're not sure whether the interpreter will know any of the family members and refuse to divulge the story and actually gave up pursuing the case. So the FGU have repeatedly asked the authorities to resolve the medical interpreter issue, improving the procedure of the medical services, and hope that they can have resident interpreters in public hospitals with clear professional training mechanisms so that the professional medical interpreters have the ethics and the competence to ensure the privacy of the victims. Otherwise, when the EMs will come to abuse and sexual violence, they will continue to have no support and actually to let the problem deteriorate in these EM communities and in hospital authorities. And for the EMs who need to require they have no statistic on those using the interpretation service. They have no idea how many EMs have been using the HA interpretation service. Without this statistics, we have no way to prove that whether the interpretation service provided HA is sufficient. If we compile such statistics, we can show that a further proof that we need to have a resident medical interpreters to ensure that the EM's persons, in case of need, they were able to be offered interpreters right away and someone they can trust, which is the main point. Well, Madam Deputy, the original motion mentioned that there is a suitable place of high privacy protection for setting up a 24-hour one-stop crisis support center, and not the government has no such service. Just having this NGO as setting up a crisis support center in some public hospitals to deal with abuse and sexual violence cases. The administration, in response to members' inquiries, if those persons require one-stop service, they can go to the Crisis Support Intervention Center, and the hospital handling is already one-stop service mode. And according to those in the front line, even though it was stated on the guidelines, it seems to have a holistic policy. As you can see, in the hospital, there's no dedicated rooms, and there's no video recording facility. And for statement taking, like I said, they only do it behind the curtain. How do we ensure that the victims, those being abused or being sexually assaulted, they would not suffer from re-traumatization, so that they can be entrusted in a secure environment to provide the statements? I hope the administration can consider our proposal. I so submit. I will support the motion and all the amendments.
Dr. Fernando Cheung. Madam Deputy, first I want to thank Dr. Pierre CHAN for moving the motion on requesting the government to set up crisis support centers for sexual violence victims and abused children in public hospitals. Yes, the crisis support centers are badly needed, and I also support Ms. Alice MAK's amendment. Mr. Ka-chun is supposed to move amendments as well, but then he has to attend a court session, so he cannot be present. But I speak with mixed feelings. Dr. Chi-kwong is here. We've been talking about this for more than a decade, and Rain Lily also proposed or stressed that one-stop service was most important for such victims. And it's not that nothing has been done, and I know Dr. Chi-kwong has helped in 2005 when I was a member of this council. I, together with members, helped to promote this mode of operation, which has been in operation for years in other countries.
Well, many other countries, even those that are developing countries, have got such an approach. I think the concept is clear. We don't want the victims to be subject to further harm. We don't want them to have to rush around because they're already suffering from a trauma, both physically and psychologically. We don't want to cause more harm. There's no reason for us to cause them more harm and ask them to have to go from one place to another. It is very simple. It is not that difficult to understand. Dr. Chi-kwong knows that, and many service providers also know that. Well, usually the first place of call would be the hospital. So we need to set up the crisis support center in a hospital, but don't make it to be stationed in the A&E department, because it is very rushed and it is not a place that you can make sure that the victims have a sense of being protected. So the crisis center has to be set up in a hospital center, but please don't have it at the A&E department. Make it somewhere else so that the doctor can attend to the victim immediately. The forensic doctor can arrive on the scene, and should there be a need for other devices, then again they would be available. But it would be very good that there will be the support of hospital services and equipment. And then the police can also go to the crisis center to take a statement from the victims and to prevent sexually transmitted diseases. We can also provide the service of the social hygiene division. So it's a simple logic. Well, I think does the administration understand it? I think the government just doesn't want to admit the recognition of Rain Lily. Well, Rain Lily isn't just a service provider. It also advocates for a change in the policies. So when you advocate for a policy change, then what you say won't please the ears of the government. So what happens is that the government has come up with the idea of a one-stop service, and then we have open bidder, and then the group of Tonghua hospitals got it, and it is neither here nor there. It is just a matter of there is a dedicated staff member taking the victim to visit the police station to give a statement, go to the forensic doctor if necessary, take the victim to the Department of Health. So it's a matter of having one single officer taking the victim here and there, instead of having a one-stop service center in its true sense. Well, Dr. Law is now in the post of the Secretary for Labor and Welfare. I think you used to help the Federation to help victims of sexual violence. Are you going to show us the same sympathy? Now we have Dr. Look, who used to be with the Kwong Hospital. He's very sympathetic towards the victims. Now, of course, in hospitals, we have got limited space, but then we do have rooms that have been locked up because we haven't got the manpower to run the service. It was the case in the past. It is still the case now. So Guanghua Hospital got some money to renovate a room, and then Zhang Miuqing also carried out a study for the particular federation I referred to. It was very effective. Dr. Look left Kwong Hua Hospital has to be redeveloped. So this center was evicted, and it went to United Christian Hospital as Dr. Look was stationed there. Now UCH is redeveloped, and so again the center has to be evicted, and it went to Prince of Wales Hospital. Now a few years ago, that hospital had to be redeveloped, and again, Rain Lily has been sort of evicted. At that time, I talked to Dr. Leung Pak-yin. I asked for the center to be kept there. At the end of the day, the hospital authority was willing to keep it at PWH. But I'm sure sooner or later there will be a third eviction, a third relocation. But I think and I hope that it will remain at PWH. So it has been sort of in place for quite a period of time. Now some guidelines have been changed, and then the police has been asked to help. So the frontline officers will not refer the victims to Rain Lily. So Rain Lily would not be the first point of help because it is run by NGO. So you have to count on the community's efforts to persuade the superintendents of certain hospitals to let them stay at a particular hospital. So that went on for a decade or so. So it is most absurd. It is a very sort of good model, and yet you try to suppress them. But they're still very sort of popular because it has got a better service. But you are not well, you are simply asking somebody to accompany the victim to go around the departments. I don't think you can call it a one-stop center. So, Dr. Law, follow the voice of your conscience. You can't agree to the arrangement that the victim has to go to different departments and recount the story again and again to a stranger, though he or she may also be a professional. Now, for the past 17 years, Rain Lily has processed 3,500 cases. More than 2,200 were rape cases, among which only 60% ended up in a police report, just 1,600. The DOJ only took 500 cases to the court, and then only 150 cases resulted in a conviction. So 11% is the prosecution rate, and then conviction rate is a mere 6%. So, Madam Deputy, we are talking about very serious crime cases. How come that the conviction rate is so low? Well, for Rain Lily, their head told us that for the High Court, the conviction rate used to be 91% across the board. So if a case goes to the High Court, we usually get a very high conviction rate. But then for such cases that we're talking about, the conviction rate is really, really low. I think the victim knows well that he or she is going to suffer even more harm by going to court giving evidence than the trauma itself in the first place. So, Dr. Law, well, don't pass the buck, Dr. Law. And the FHB should also help the LWB, and then you need to provide accommodation at the crisis center as well. Thank you.
公及福利局局長。
Secretary for Labour and Welfare. Madam Deputy, so I'll be too attentive to the members' speeches. Once again, I'm grateful for Mr. Pierre CHAN for moving this motion debate and the amendments raised by Alice MAK and Dr. Fernando Chang. Madam Deputy, this motion is an opportunity for us to seriously debate how do we support sexual violence victims and the child abuse prevention, and as well as on the issue of interpretation provided for ethnic minorities. And we're supporting for sexual violence victims. The members have noted that since 2007, the Social Welfare Department have launched this one-stop service mode in handling sexual violence cases. Such service emphasizes putting people first and through a dedicated social worker to provide round-the-clock outreaching service and to coordinate and to arrange a continuous support and follow-up service. For example, healthcare, forensic examinations, statement taking, emotional counseling, social worker support, and service information. According to case experiences, that the victims of different as for incidents have divergent needs, and the service and required and the location to accept such services also varies. The aim of the one-stop service is to help the victims to accept the service in a safe, convenient, secure, and supportive environment. And under the accompaniment and the coordination of dedicated workers, they could reduce the need of the victims to repeat their unfortunate episode. And to step up support of sexual violence victims, the hospital authority have provided 2 dedicated rooms, one as a backup, in all 18 public hospitals. So when necessary, that for the use of the sexual violence victims to ensure that they receive the service and conduct the procedures in a safe, convenient, secure, and supportive environment. And when the sexual violence victims would need to accept healthcare attention in public hospitals with consent of the victim, the frontline staff will, as soon as possible, arrange healthcare forensic examinations, emotional counseling, and statement taking and other proceedings in these dedicated rooms. The SWG, working with HA and the police, will from time to time inspect these designated rooms in each hospital to ensure that these locations meet the principle of convenient, secure, and private, and would conduct drill exercise in public hospitals of the procedures of one-stop service to ensure that the relevant healthcare and allied professionals are familiar with the relevant procedures and working together in the provision of the one-stop service. And now, for the service providers in these dedicated rooms for sexual violence victims in all 18 hospitals compared to the 3 crisis support centers in Ireland, Kowloon, and New Territories, and with a more timely provision of service and support for sexual violence victims. In the long term, the hospital authority will consider enhancing the dedicated rooms in the new or the renovated hospitals for patients of different needs, including sexual violence victims. All in all, the Korean one-stop service model, through a dedicated social worker to accompany the victim to coordinate the procedures and the service it need, and the dedicated rooms provided in all 18 hospitals with the consent of the victim, is to let the victim to receive the same procedures and services in the same location. And in order to promote the mutual collaboration of the relevant departments and organizations when dealing with sexual violence cases, the SWD worked with HA, police forces, DOJ, LAD, and the NGOs. They will jointly formulate procedure guidelines for handling adult sexual violence cases, revised in 2007, with the purpose of helping to those professionals helping the sexual violence victims in taking a consistent approach. According to the procedure guidelines for female victims, the public hospital, which where practicable, assign a female healthcare staff to contact or comfort the sexual violence victims and arrange a location that can protect the victim's privacy as a location for meeting and for conduct examinations to reduce the trauma on the victims. The hospital will refer to the welfare service that are available to the victims, including the dedicated social worker in handling sexual violence cases, as well as the round-the-clock outreach and crisis intervention service. If the victim have yet to report to the police, the healthcare staff and the doctor will suggest the victim to report to police as soon as possible and provide all practical assistance. Ensure that the rights and the privacy of the sexual violence victims are fully catered for. The police will arrange police officers of the same gender of the victim and those receive relevant training to meet the victim. And with the consent of the victim, and where practicable, arrange the victim and at the same location in the same public hospital to receive treatment, including the dedicated room as mentioned, to take the statements and conduct forensic examinations. And based on the victim's wish, with the company of the dedicated social worker and other suitable persons to meet and the police officers and undergo forensic examinations. And some of the statistics, the SWG Central Information System of Spouse and Co-inhabitant battery cases, social violence cases by SWG, collect the information on spousal co-inhabitant battery cases on the overall statistic handled by different departments. And the motion mentioned the victim statistic on public hospital receiving treatment or examination. Currently, the HA medical system have not kept such records and data. And the A&E system, the statistic on indecent assault and sexual abuse, was as a diagnosed coding based on the clinical initial symptoms and may not have used sexual violence as the main clinical marking, so they're not able to obtain the relevant data on sexual violence cases precisely and offer a general picture. The police have not kept record on the statistics mentioned in the motion. The departments will look into how to enhance the record keeping of such data. And on the handling of child abuse cases in public hospitals, in this aspect, in the best interest of the children, as well as to protect the children suspected of abuse or being abused, the SWT work relevant departments, including the HA, EDB, Department of Health, Police, and the NGO and relevant professionals, have jointly formulated the procedure guide for handling child abuse cases. According to the procedure guide, the pediatric ward of the public hospitals have appointed a medical coordinator on child abuse and handling such cases, and they usually don't need to first go to the A&E departments. They're actually going straight to the relevant locations. And when the staff suspected child cases, they will consult the medical coordinator and will admit them to the hospital for treatment and would refer the cases to the SWG of the Family and Child Protection Service Unit of SWG, as well as the Child Abuse Investigation Unit of the HKPF. The whole procedures are set on the principle of safeguarding the best interests of children. On the review and the procedure guide for handling child abuse cases, in order to let the different professions cooperate effectively, in November 2016, the SWG has set up a task force to review the whole procedure guide. And the task force have consulted the stakeholders in 2017 early on the definition of child abuse and its handling, holding different consultation sessions, meeting with the stakeholders of different services, especially the parents and children and those with different sexual orientation, in order to canvass the views of diverse groups of people. The task force have set up a focus group to discuss these views in depth and expect to conclude the review by the second half of 2019. The SWG will also conduct different training courses for the frontline professionals to enhance their techniques and knowledge on handling domestic violence, including child abuse cases, and enhance the competence of frontline staff in risk assessment, violence prevention, and post-trauma counseling. Furthermore, the SWG will dispatch staff to attend the training activities organized by EDB, Police, HA, Department of Health, and NGOs for frontline service staff to provide training on child protection. In 2017-18, the SWT had organized 160 training courses for frontline professionals with attendance at around 7,700 people. And to facilitate the frontline workers an understanding of the situation and the needs of those of different gender, the ethnic minorities, and the sexual minorities, the Social Service Department organized a series of training for the frontline social workers to enhance their attitudes and techniques of them serving those with diverse backgrounds, in order to let the police department to fully grasp the technique and the knowledge in handling sexual crimes. The Police Academy, as well as the Detective Training Center, have incorporated these issues into their regular courses, including the RPC Foundation Training Program, as well as Probationary Inspector Foundation Training, development programs, promotion courses, and detective training programs. Furthermore, the police had incorporated the protection sensitivity and the handling of abuse cases and sexual violence cases into their on-the-job training content. And for the interpretations provided to EMs, and since the language and culture and service needs of the EMs varies widely with diverse background interpreters themselves, there's no uniform service standards on interpretation and translation services. And yet the interpretation and translation services provided by the NGO at the public hospitals and the HAD have certain requirements to ensure service quality at a reasonable level. The public hospital interpretation service provide 18 and EM language interpretation service mainly through service contractor, part-time court interpreters, and the relevant consulate for the EMs in need. The public hospitals had already formulated a procedure guide for hospital staff on the summoning of interpretation service in order for the effective deployment of such services. To ensure the service quality, the EM had through the service contractor, which is the HK Chi-kwong Lady Medical Center, to arrange all interpreters to receive the relevant profession training on professional medical knowledge. Will work with the university's Chinese and bilingual studies representatives to conduct annual inspection of hospitals and monitor the quality of interpreters. According to questionnaire results, service users are generally very satisfied with the interpretation service received in hospitals. And the HAD, by appointing the Hong Kong Christian Service Care Center and providing all the basic services, and also set up dedicated courses and inclusive activities, and also provide general interpretation service and translation service in 7 EM languages. And all the interpretation staff in the center will need to complete secondary education in Hong Kong or overseas, able to read or write English and at least 1 EM languages. Besides the testing and the recruitment, the interpreters will need to receive regular assessment and training. Madam Deputy, I so submit. After listening to the members' views, I would respond to their views and the amendment motion of 2 other members. Martin Liao.
Madam Deputy, any crime that involves violence and abuse is like a tumor, and you will cause harm to the victims. And for the vulnerable groups, in particular children, I think the harm is even more serious. If the abuser is a family member, or if the victim of a tragedy is a person with special needs, then it is an even more serious case. Well, I think it is indeed important for us to help them to address the problem. It is duty bound on us as a caring society, and we need to uphold justice. Unfortunately, if we look around the world, it has never been an easy task. Now, this is particularly so in the Me Too campaign in the USA, as well as the Korean film touching upon the same theme. They have attracted a lot of attention. Well, I think it's a matter of we always have a taboo concerning sexual offenses. It is indeed very difficult, and it takes a lot of courage to step forward to allege the offender in a abuse case or a sexual offense case. It is a very serious insult, and it is difficult for the victim to repeat the same account again and again. It is a lot of pressure. For many victims, it is like suffering from the trauma once again. And as a result of such a sort of difficult pressure, many victims have stayed away from the court, and many offenders are allowed to be let off. In recent years, we have paid attention to a number of serious cases. We have been abhorred by the evilness of the cases, and we are also sort of sad when we see that the victims are quite helpless. Well, in fact, for the SWD, a decade ago, have come up with a 24-hour one-stop service center, hoping that we can provide medical, forensic, counseling and support services and taking of statements in one go. And whenever possible, all around the territory, we have got a dedicated room at 17 hospitals to provide one-stop service. But irrespective of the amount of work done by the government, I think it's a matter of we have to check whether they are effective in helping the victims. According to the police, in year 2017, there were 65 cases of rape. Only 4 of them were processed at a one-stop center. That is, giving a statement, checked by doctors and checked by a forensic doctor. So only 4 out of 65 cases. Well, the figure itself tells us that the utilization rate is low. Well, the administration has told us that it is due to different reasons. Some of them are understandable. Say, for example, the details of cases differ, and then the preference of the victims is different. But then there are also other causes that we believe should be blamed on the poor coordination among the departments. Say, for example, public hospitals are running out of beds, and then the police may want to have the statement taken in the video recording motion fashion, but then there isn't there isn't space for that, and then sometimes interpreting service is not readily available. So I think there are many gaps in the service, and I think all the parties involved should take it upon themselves to improve the standard and quality of the service. I think we need to put ourselves in the shoes of the victims. I think the one-stop service should be true to its features as a one-stop service center. Now, when we look at the motion as well as the amendments, I think we are merely making very humble requests. What we are trying to do is to have a dedicated space with high degrees of privacy at 3 regional hospitals so that we can have a one-stop service to deal with the crisis. I think the government should consider how victims are being sort of treated, and we hope that the frontline officers dealing with the cases will be given the right training in terms of sensitivity, among other things. And we also want to have adequate interpreting and translating service. Madam Deputy, even if we can implement all those requirements that we have included in our motion and amendments, it is but a small step forward. For us to combat sexual crime as well as child abuse, I think we still need the cooperation and support of everybody in the society. We have to be alert to potential cases. We should change our view of victims of sexual offences, and we have to update our legislation. For the police as well as the judiciary, when they deal with such cases, they have to be more sensitive, and we must give confidence to the victims. Make sure that they will have faith in us so that they know that justice will be upheld. And so I submit, Madam Deputy. Mr. Leung Yiu-chung. Madam Deputy, on the face of it, the Secretary's reply seemed to tell us that in relation to the victims of child abuse and sexual offences, government's arrangements are really verging on being perfect. Well, for the members moving the motion as well as the amendments, it looks like that we are sort of exaggerating the problem. Madam Deputy, well, the Secretary may think that the system is fine, but I hope that the Secretary will be more patient in listening to us and try to understand what we want to say in our speech. For the motion as well as the amendments, I think members are telling us that they want the administration to follow the WHO's guidelines. We would like to have the WHO guidelines for medical legal care for victims of sexual violence. That is, we hope that the service can be provided at the same place in the hospital, and the victim should not be made to get exhausted by having to go to different departments and service providers. Well, for victims of sexual violence, both physically and psychologically, they have suffered a lot. After the trauma, if they have to go through a lengthy and cumbersome procedure of giving statement, reporting to the police, etc., it will be very bad. And for our current support, I think it is undesirable. Now, a victim after the trauma has to visit different places. First of all, the victim goes to the hospital to get treated, examined, and given medicine. And then the victim goes to a police station to give preliminary initial statement. And then the victim goes to the police station assigned. The victim may have to go back to the scene of crime, and the victim will be examined by the forensic pathologist, and the victim has to repeat the statement again. And then, as Dr. Chen has said, it may easily take 8 hours or even 20 odd hours in an extreme case. So it is very exhausting for the victim, and the victim has to recall and repeat the tragedy. And is it really humane to do so, to treat somebody like somebody who's already a victim like that? I think for the A&E department, it is always very busy, and most of the patients are only separated from others by a mere curtain. So there's no privacy for the victims. And I think they find it most difficult to tell you what has happened to him or her. And it's very embarrassing, and they will be in fear. So to reduce the likelihood that the victims will be subject to further harm, I think in Kowloon, on Hong Kong Island, and in New Territories, we should have at least one hospital. It's best to have more than one that can meet the WHO guidelines, so that it is a safe place with a high degree of privacy, so that there will be treatment, report to police, statement taking, forensic examination, and counseling being given. Well, I think the difference between this proposal and the current arrangement is that victims don't have to go to different departments. Instead, professionals should arrive at this one-stop center to provide service, and the victim doesn't have to tell the story again and again. And there should be adequate guidelines. Like in the case of Taiwan, professionals have to gather together in the same room as the victim, and they listen to the victim, and if necessary, then the police will ask for a more detailed statement to be taken. Some victims have told us that for police officers that take statements from them, they are not friendly. On the contrary, victims are harmed once again because of the poor attitude on the part of the police officers. Sometimes this has discouraged the victims to pursue the case. So it is good for members to ask for the following in the amendments. That is, there should be professional training for frontline officers so that they have the right skills and knowledge to help the victims, so the victims won't have to undergo secondary harm, and this will then encourage the victims to step forward to speak up. Unfortunately, Mr. Ka-chun cannot come here today, but I support what he is advocating. There should be two different teams, one for sexual violence, another for child abuse, so that there won't be any overlapping of resources. Now, for victims who go to a police station to report the matter directly, then the regional crisis support center should be alerted and take over the case, so that the counseling service and other service will be provided on the same spot. And then the victim will be spared the trauma of having to repeat the story again and again. Well, I think many victims, they're not report the matter to the police or to seek help, but then delay would make the case difficult to follow up. So it is important to encourage them to step forward as soon as possible. In Malaysia, as only back as 1996, they had made a special arrangement to encourage the victims to speak up.
主席。
Mr. Yu Siwing, Madam Deputy, sexual violence and child abuse are things the community has to face up to. Well, these things happen in all kinds of communities, and regardless of the culture and background. And abused children may not be fully aware of their rights, and different schools may have different ways in handling domestic violence, and so abused cases of child abuse may not be dealt with expeditiously. Whether it be sexual violence or child abuse, the psychological impact on the victims can be far-reaching, and their lives may be ruined. Hong Kong is a developed city. We should have a mechanism to try our best to help victims. For cases received by the SWD, we have seen a rising trend in recent years. In 2017, the SWD received 967 cases, up 12.3% compared with 2016. On average, we have more than 2 cases related to sexual violence. And again, for cases of child abuse, the number of cases rose from 874 reported cases in 2015 to 947 in 2017. We must not turn a blind eye to the situation. I agree with Dr. Pierre CHAN's motion to set up 24-hour one-stop crisis support center in 3 districts. And with regard to the guidelines for medical legal care for such victims issued by the WHO, we should provide support according to the guidelines. And I think we should extend guidelines for handling cases involving children as well. The guidelines cover lots of areas, details on how the support centers should be set up, how cases should be assessed. I think the guidelines are very useful for frontline workers in handling these cases. They provide standards from forensic examination to follow-up by social workers. There are very clear requirements in the guidelines. Although we have yet to set up such a crisis center, the administration claims that there is already a one-stop service for victims. And I think the guidelines are very useful for the police, the healthcare personnel, and social workers. Sexual violence can happen anytime, anywhere, at home, at your workplace, and victims are subject to extreme pressure, and they may find it hard to recount their difficulties. And if they are not given timely support, there may be psychological trauma. And as for child abuse, according to SWD, 70% of the perpetrators are parents of victims. Such cases are hard to detect. According to the Royal School of Psychology of the UK, physical and sexual abuse can lead to trauma with far-reaching implications, and therefore the government must have guidelines to tackle such things. The current approach is such that victims have to go through complicated procedures, and they have to go between hospitals and police stations and forensic medical officer's office. They have to recount their trauma again and again, and that can be the cause of secondary victimization. It was reported in the media that some victims had to suffer close to 20 hours when they had to face the police, and doctors, so on and so forth. And many of them have been put off from reporting such cases to the police, and that's what Dr. Fernando CHEUNG said as well. And therefore, the administration must review its current policies and approach. I think cases of child abuse will face a very similar scenario. I agree with Mr. Alice MAK. We should set up a special investigation team to deal with victims so that there won't be another trauma for victims. Mrs. Ka-chun asked the 2 professional teams be set up in each crisis support center. I have reservation about this amendment. I think it is well-intentioned but too idealistic. There is a huge demand for public health care services. Although A&E department has substantially raised fees, and the long queues are still there. Frontline doctors and nurses have seen a high wastage rate, and then their workload is very heavy. Even though the government has started its discussion with UGC to increase the number of subsidized places for medical personnel so that there can be more manpower supply for our public healthcare sector. Still, the manpower shortage is not yet resolved. Now, if we are to set up 2 professional teams in each crisis supporting center, it would be already difficult. And if we do so, we will cause more pressure to bear on our public healthcare sector, and public healthcare services will indirectly be affected. So, the administration must deploy manpower properly. If a crisis support center is to be set up, there must be a reasonable budget set up, and the procedures should be streamlined as far as possible so that victims can be properly looked after and the trauma to them can be minimized, and perpetrators should be penalized. Thank you. Mr. Alvin Young. Thank you, Chairman. Because of my profession, I've come across victims of sexual violence in courts. Of course, I've faced 2 parties, both parties to such a case, and the outcome of a court case may not always be desirable. Whether I represent the prosecution or the defense side, I think the person giving testimony at the witness box is someone very brave. I thank Dr. Pierre CHAN for moving the motion, and I thank members for moving the amendments. On behalf of the Civic Party, I will support the original motion as well as all the amendments. The reason why we have this debate is because, as said by members just now, the situation in Hong Kong is such that there are things we can do to our system. Now, for those who are willing to overcome the psychological hurdle and to come out and retell their experience again and again, it's not easy. They might have to recount their experience. They may fear being ridiculed, and they may fear criticism. I think this is understandable. As a result, many victims would choose rather to swallow their experience silently. So when we want victims to retell the experience to people they trust, but how much have we done to help adults to tell their ordeal to another person. Now, when a victim goes into the police station, she may wonder whether this is the appropriate place to handle her problem. We cannot blame the victim because she won't know whether that is the right place. However, when she has already told her story to a police officer, she may have to be referred to another police station, and she has to see a social worker and be examined. And unfortunately, she has to retell her story again and again. This is secondary, tertiary victimization, and this is not a good thing. And we have to admit that court procedures are not perfect, and very often the victim has to repeat her story again and again. So we have to ensure that they can feel safe in a protected environment for them to recount her experience. And I think this will only benefit the administration of justice. According to the police, in the first half of this year, there were only 9 reported cases of rape. Is that a true picture? I very much hope that it is. But what is worrying is perhaps the hurdles put there by our system have lowered the actual number of reports. Of course, adults have the right to decide whether they want to report a case, but for children that have been subject abuse may not have the information or wisdom to do so. We need intervention from adults, social workers, and teachers are very often the people to expose the painful experience of children. The SWD received over 1,000 cases of child abuse every year, but we've only got about 47.6 cases of successful conviction. Perhaps this is directly because we don't have a law against child abuse in Hong Kong. But I think there is room for improvement, and a lot leaves to be desired. And I think all officials here know what should be done, and I think we should provide the right way forward for the people of Hong Kong. This motion provides a possibility for proper procedures for these victims. Society is not perfect, we accept this, but I think the proposals here can help us to progress. To have crisis support center in our public hospital is the right way to go. Hong Kong is an affluent place, and I think we do have the resources in our public coffers. And if we wisely as not to provide resources to support these victims, this is regrettable. I hope the Secretary in his reply would not use the same line to take. He has to accept that there is room for improvement in our society, and we should offer assistance to other people, whether they be teachers or social workers. They need more information. They need to be better equipped so that when they spot a problem, they know when and how to intervene. Now, I've mentioned social workers and teachers. I must not leave behind our police officers. I know their workload is heavy, but we should give them simple procedures to follow. Otherwise, no matter how eager they are to help, they can't. We are not proposing a crisis supporting center out of the blue. We're asking whether SHIU, which has got a deficit year after year, will have the resources to run crisis support centers. And if the HA has got its budget slashed, then it cannot really support a crisis support center. The government should provide more resources to help people that are in genuine need. This motion has the support of all political parties here, because ultimately we are talking about help to Hong Kong people. And I hope that the government can be willing and genuine to listen and support our motion. I hope Dr. Law will not let us down. Thank you.
Dr. Elizabeth Quat. I'm sorry, Mr. President. I'm still recovering from my disease. I agree with the motion as well as the amendments. Well, I think in Hong Kong we have seen many cases of sexual violence cases. In 2013, there was a survey. 1 out of 7 women in Hong Kong has had an experience of sexual violence. So once every 7.4 hours, we have a case of sexual violence. For Rain Lily, they received 3,501 cases asking for help. And in fact, there was an increase of 116% over a period of 17 years. Now, of course, being the male sex, you may not know about the sufferings of the other sex. When we had a chat among the females, we asked if we have had any experience of sexual harassment or sexual violence. Many of them did. Say, for example, we were sexually assaulted by elderly family members, relatives, teachers, and when we went to board a bus or MTR, especially when you were a secondary school student and you were sort of donning a school uniform, you would easily have been the target and victim of sexual violence. I can tell you that in fact I was also the victim of a sexual assault when I was young. And like others, my first reaction was to freeze. And did I tell my family? No, I didn't, because we did not tell the story and we didn't know how to tell others. And then many people suffered from sexual harassment or even sexual assault in your workplace. So it seems that sexual violence is a taboo in our society. In particular, if you know the perpetrator, say for example your teacher, your professor, your coach, your priest, etc. They are people occupying positions of authority or power, and so you dare not speak up. Now, from a survey, it has been found that most of those who have responded told us that 44% of them would choose not to speak up and won't tell others. Now, in the unfortunate case of a sexual offense, the victims may choose to report to the police, but the case may be dropped or they would just stop pursuing the matter. I think this is quite common. Now, if somebody has been sexually assaulted, what will happen to him or her? Well, from movies, you would know that it is a most unpleasant experience. You'll be in fear, you'll be in anger, you'll blame yourself, you'll be exhausted. And where should the victim turn to get help, and who should come in to help? Well, probably the victim will go to a hospital. Now, when the victim goes to a hospital, he will or she will have to go through a number of steps. No one would tell the victim how many steps would be involved. Rain Lily told us that you would expect no sleep for another 15-16 hours. You get physical examination at a hospital. You'll be administered contraceptives. You go to a police station to give a statement. Go back to the scene of crime to get exhibits, and then the forensic examination takes place. You go back to the police station to give another statement. You may have to give 5 or 6 or 7 statements. Uniform officers take a statement followed by CIDs, and then the regional crime will take another one. When you go to the forensic pathologist, you recount once again, and then of course you have to repeat it when you go to court. What else will have to be done? Maybe probably it is only by then that you have time to take a shower, and you will be so exhausted that you might have given up midway. Rain Lily told us that delay and deferred report to police is quite common. Sometimes the postponement might have been a long time. Among the 2,318 cases received by Rain Lily, there was a delay of as much as or as many as 949 days. In other words, 2 years and 7 months. It is difficult to expect the procedures to be completed within a short period of time. So if we can get the one-stop service center as advocated in the motion, then probably we can expect an increase in the number of cases reported as well as the conviction rate. According to the Secretary, it appears that the government has done all that has to be done and there's no need for this motion debate. Now, Hong Kong seems to be an open society, but in fact, Hong Kongers are very conservative. For the victims of sexual offences, they are usually being dismissed. Say, for example, if you have been assaulted sexually or you have been raped, you will say that you should watch out. You should watch what you are wearing, and then if you are too thinly clad, then you have only got yourself to blame. I cannot see why the government is refusing our proposal, that is, set up a center at each of the 3 regional hospitals so as to help the victims to go through the harshest moments in their lives. And in this way, we can prevent victims having to suffer from the harm once again. I think it's duty bound on the part of the government to do what has been proposed in the motion. Mr. Ray Chan. Mr. President, I would like to thank Dr. Pierre CHAN for moving this motion to help the victims of sexual offense and child abuse. The government used to avoid the subject of sex. Now, in fact, the LWB, the FHB, as well as the Security Bureau should be involved. At a security panel meeting, I asked the Security Bureau to tell us more about the fact that some frontline police officers have been abusing their position when they had to investigate into sex cases involving sex workers. I think it is not easy to talk about giving support to such victims. Well, sex is always a taboo. For somebody who dares to go to the police station to give a statement, to report the matter, to go to a hospital to get examined and to get counseling, etc., I think it takes a lot of courage. Many people don't want to be humiliated. They don't want to be blamed. And when they are discouraged by a sort of obstacle, they would easily give up. They would refrain from seeking help, and they are letting off the offender. Last year, there were 65 cases of rape. It appears to be a small figure, but in fact, it is an underestimation. 44% of the victims have not reported to the police, according to the Rain Lily. 56% of them, that means 712 victims gave up in pursuing the matter. Well, for somebody who overcomes all sorts of hurdles to repeat the story many times, will she or he get justice done? Now, we just want to have a humble request being answered. We want to encourage people to report the matter to the police, and we hope that we can shorten the procedure as much as possible. Well, in the past, when we dealt with the cases, professionals would expect the victims to come to see them. Now, they are the victims. I think we should reverse it. It should be victim-centered instead of professional-centered. Victims are most vulnerable when they have been hurt in the trauma. I think we need to provide a one-stop service center so that we can make it easier for a report to be made, and then we can have a high chance of convicting the offender. The convention is that the male would be the abuser the offender. But in fact, it is sort of not the case. When I was a young child, I had been sort of molested when I was swimming, and then another bus passenger would sort of pinch my bottom. So I think as a result of the Domestic and Cohabitation Relations Violence Ordinance, I think the sexual minorities, etc., have also been sort of respected. I think they should be given equal treatment. In August this year, together with SHIU Hong Kong, an NGO carried out a survey among the lesbians. 77% of them have suffered from violence from an intimate relationship. 70% of them have been forced to have sexual intercourse. And then early this year, there was also another survey. 45% of those interviewed had suffered from violence. 3.2% was sexual in nature. For another survey, it was said that only 22% of the lesbians had turned to the police for help. So it is a matter of having trust in the frontline police officers and whether frontline police officers have any awareness and sensitivity towards the sexual minorities. Well, I think it is difficult for sexual minorities to speak up because they're afraid that others won't understand them. They may think that they haven't, citizens may not expect sexual offenses against the sex minorities. They think that only when there is the penetration of penis would it be counted as a case of sexual offense. I think we need to enhance our awareness. Otherwise, frontline officers won't understand the case, and it may even result in an insult. Police officers may find that the exhibits involved sort of very filthy, etc. So they even labeled it, saying that it belongs to the gay man. So it seems that it is something to be handled with care. Well, I think there are many factors discouraging report to police. I think most of them are worried that they will be discriminated by the professionals. They're also afraid that the service providers may not know how to deal with same-sex couples and the violence or the crime that takes place among them. So we need to train the professionals so that they know the features and also the needs of the sexual minorities and also people of different sexual orientation. I would have liked to talk about protection of the sex workers, but I don't think I've got time. When sex workers provide service, they would be subject to sexual bullies and sexual violence. But then as a result of the stigmatization, they dare not come forward to help, to seek help, and police officers have assaulted the sex workers. They may think that they have only got themselves to blame. On the 17th of December, it is a day to stop violence against the sex workers. I think everybody should be equal. No one should be subject to sexual violence. I support the motion as well as the various amendments, and I hope that the government will actively consider our proposals.
Mr. Yip Kin Yun. President, Mr. Ka-chun is in a trial, so he cannot be here personally to express his views, and he has asked me to help him to express his views on this matter. And I would like to summarize his views expressed in his amendment. Now, Mr. CHEUNG wants to thank Dr. Pierre CHAN for moving this motion. Looking back the history of this council, the last time we had discussion on support for victims of sexual violence was in 2000. It was a motion moved by Mr. James Toh. It was a non-binding motion, but with the passage of the motion, it seems that things have changed, at least. In December 2000, Rain Lily, an organization to support such victims, was set up, and it is still in operation. Mr. SHIU supports Dr. Chan's motion because he thinks that it is a humane way of trying to provide support for victims. And then he would like to talk about 6 myths involving the government. First, one-stop. What is the difference between one-stop service and services provided by the government? First, Rain Lily would like to have a one-stop crisis support center. They've been asking for more than 10 years, and Mr. SHIU doesn't think that the government could not do it. What is lacking is the will. In May, in a question time in this council, in answering Dr. Pierre CHAN's question, the Secretary for Security said that one-stop services are available for medical treatment, forensic examinations, statement taking, and provision of services. Yes, this is just a full range of service, but not really one-stop service. By one-stop services, we are saying that the victim should be in one place, and then he or she can have access to all services including medical treatment, forensic examination, blah, blah, blah. And the victim doesn't have to go from one place or one office to another. And the government doesn't fully understand what is one-stop service. And that is one of the reasons why we can't have a crisis support center. And the second myth of the government is there aren't enough victims. Mr. SHIU is of the view that we can't have a crisis support center because there aren't enough victims, and this is very frustrating. In 2017, according to SWD, there were 967 newly reported cases of sexual violence. On average, we had 3 per day. Isn't that enough? And how many more victims does the administration want to see before it is willing to act? Besides, sexual violence can be rather hidden. You never know how many victims are out there who are not willing to report these cases because of their shame. And then Mr. SHIU wants the council to take note of 3 points. First, he has amended Dr. Chan's motion to be more specific. He talks about all types of sexual violence. Sexual violence is not just rape, indecent assault, and sexual harassment can also bring incredible trauma to patients, and therefore all types of sexual violence victims should be covered, according to Mr. SHIU. Mr. SHIU wants a crisis support center to have 2 professional teams, one dedicated to handling sexual violence cases and the other to handle child abuse cases, for very obvious reason, because social workers that know how to handle sexual violence cases may not know how to handle child abuse cases, and vice versa, because cases involving adults and juveniles are totally different, and they should not be handled by the same professional team. And the third amendment is, if a victim makes a report to a police post, the police officer should immediately notify the suitable district case crisis support center to take over the case, so as to obviate the need for uniformed police officers to inquire of the victim, because every time a victim recounts her story, it is other trauma. So this should be avoided as far as possible. Mr. Li Ka-chun wants a boasted of very high detection rate of rapes that was as high as 95.1%. The fact is, many people were put off from reporting cases to the police because of the complicated procedures. Now, some victims have to consult counselors because of the hurt they suffer when reporting a case. Mr. Lee Ka-chun may not like to hear this, but victims should only be allowed to report to the police when they are ready, and society should provide a safe support platform for victims so that they are all comfortable to seek help. Now, that's what Mr. Ka-chun wanted to say. Now, we are also concerned about children who have suffered abuse. I think the same principle applies. They should not be allowed to recount their abuse by adults time and again, because it is also a very sad experience. So we should also provide one-stop services for children of child abuse cases. Dr. Zheng Chuntai. Dr. Pierre CHAN's motion requests the government to set up crisis support centers for sexual violence victims and abused children in public hospitals. The motion is just a very humble request seeking minimal improvement for such victims. The reply from the secretary was very disappointing. I didn't know what he was really saying. Is he for or against setting up this support center? We want a one-stop crisis support center to be set up in public hospitals to improve the administrative procedures for handling sexual violence and child abuse cases. We just want that we have a better environment to handle such cases. But he talked about not having the statistics and no procedures. He has been mumbling for the whole morning, and this is very disappointing. Before I conclude my speech, I want to make a few things clear. First, when it comes to sexual violence and child abuse cases, we call them cases, but in fact, sexual violence in particular doesn't involve only one case. Now, the victim's family, his or her friends and relatives can be affected throughout their lives, and the impact is not just on the individual but on the whole family. Well, you might have watched movies. A very famous Spanish director produced Almodovar produced many movies involving sexual violence. You can take up some of his recent movies. Why we are so eager to help? Because when it comes to sexual violence, they should not be regarded as isolated or one single case. And with improvement in the environment or establishment of the crisis support center, this is not an ultimate solution. A center may improve the environment, but I think a victim needs help throughout his life so that he can live out of the trauma he has been through. And as for statistics by the government, I think it is baffling when it comes to the relationship between the victim and also the offender. I have got the figures for the first 9 months of 2018. About 64% of the offenders are strangers, and parents 0.8%, other relatives or partners or friends about 12%. And in the relationship, there is no category of couple, husband and wife. I think we have underestimated the prevalence of sexual violence among husband and wives, or intra-marriage rapes or sexual violence within a marriage are not regarded as a problem or an offense or anything immoral. Well, because they are husband and wife anyway, what's wrong if it is by force? There is not such a category in their breakdown. I think this is conceptually wrong. And why do we have this mistake? At the end of the day, we have to admit this. We call ourselves a modern and open society, but in fact, we are very, very conservative deep down. Sex is a taboo openly, and you can do what you want behind closed doors. And this is the situation of our society. And there is also this impression. Elizabeth Quat talked about how we can help a female victim of sexual violence when it comes to improvements to the administrative procedures and the environment, and how we can simplify the procedures. I think we should not just target at female victims. Statistically, female victims account for 97%. That's the 2016 figures, and 3% of the victims were male. Is it really so rare for men to suffer sexual violence? Well, as Mr. Ray Chan said, some men do not know that it's a case of sexual abuse. Like if a man has got someone to pet his chest, and you may not think that it's a kind of sexual harassment, because the standards are different. Now, when you greet a lady, you wouldn't grab her breasts. This is because we have a taboo about sex, and we don't know where the boundary lies. And so long as the subject feels uncomfortable and wants to reject this kind of advances, then this is already a kind of sexual violence. So Dr. Pierre Chan would like crisis support centers to be set up in our public hospitals. That is only simplifying the administrative procedures and improving the environment. As a matter of principle, we should avoid the possibility of requiring the victim to recount his or her episode so as to avoid secondary victimization.
Mr. Editor, thank for Dr. Pierre Chan's motion as well as the amendments by two other colleagues. I see that Dr. Pierre Chan have written me a letter and mentioned that currently only the Prince of Wales Hospital had a dedicated room for sexual crime victims for round-the-clock support. As I know that this Prince of Wales service provided by Rain Delay, and since the formation in 2002, it had relocated from Cornwall Hospital to United Christian Hospital to Prince of Wales, and now the Prince of Wales Hospital are evicting them. Why do we have an NGO to undertake such critical and important task? And Dr. Chi-kwong, Secretary, in his opening response, and takes a social worker following the case from start to finish, and comparing to the one-stop crisis support service mentioned in the motion. This is a matter of true and false. The real one-stop services is that put the victim at the center. Hope that they could just only need to go to one location. Let it be the police station. That's dedicating a space. That's how to do it in Australia. And like Dr. Pierre CHAN said, and provide in the hospitals. So as long as it is one place to undergo all the procedures, whether for social workers, forensics, doctors, and the police to provide assistance, to expedite all the proceedings, let's say for examinations and statement checking. And hope that when the Secretary, in his concluding response, and simply rehashing the government's status quo handling and claimed that the Pierre CHAN's proposal as duplicitous, which the government had not done. And the Secretary also mentioned that about 17 public hospitals having dedicated rooms for the victims. According to Rain Lily, the so-called dedicated rooms in public hospitals, some of them are storerooms, some of them are doctors' resting area, and some of them are room for the doctors to meet the relatives of patients. And these rooms, they will be used at every 1 or 2 hours, as unlike a dedicated room as requested in the original motion that reserved for victims. There were two different things. The World Health Organization have the standards. And in terms of the violence for medical legal care for victims of sexual violence, it is stipulated that they have at least 2 rooms with bathrooms so that the victims will not be seen by any stranger come into the room, and after concluding the forensic examination, to able to take a shower. That is the WHO standard. Looking at our neighboring regions, for Taipei, they have a smaller population than Hong Kong. In the city, they have 6 hospitals providing this one-stop service. In Malaysia, and claimed that for each government hospital has provided one-stop service for sexual violence victims. For Australia's case, next to the police station, they have an independent venue for one-stop service. So we have the international standards, and our neighboring cities and countries have already had taken a cleared approach. This motion should not be just have the LWB as this responding bureau. And now I heard that Secretary Law that I will now reply solely on you. According to Rain Lily, the bottleneck seems to be the Security Bureau and the police. Now that the Rain Lily location is in Prince of Wales, which is in Sha Tin, let's say if the case occurred in the island police officers, and due to the heavy workload or all kinds of reasons, they were reluctant to dispatch a team to Prince of Wales for statement checking. So they're not able to provide the one-stop service even for the Rain Lily Prince of Wales Center. First, the Security Bureau should tackle the issue squarely, so that things should not just revolve around the police, including the rape victims. And also the hospital authority must take a stand, because the Dr. Chan's proposal of setting up a suitable place in the hospital, and the dedicated rooms currently are just storerooms with a heavy foot traffic. I think the HA needs to inform the public for HA to undertake this task. They need to make a significant commitment. I also noticed other members also concerned the EM situation. I believe that the EM sexual violence victims, like Dr. Ray Chan's comments on the sexual violence victims of sexual minorities, especially the issue of interpretation, the government have in kicking the can, which depends on the individual various policies, while their support for the EM's sexual victims is definitely not enough. Mr. Kent Leung, I speak to support Dr. Pierre CHAN's original motion to urging the hospital to set up a crisis support center for sexual victims and abused children for comprehensive services. This one-stop crisis support center to allow the victims and in the same location to receive treatment and follow-up services and undergo necessary procedures, including medical treatment, forensic exams, report to police, statement taking, and receiving social worker support and counseling. And to provide one-stop and comprehensive support service to sexual violence victims so that they would spare the sex victims to going to various places, for example, the hospitals, police stations, and for forensic exams, so that the victims will not have to repeat their accounts again and again to lead to re-traumatization. President, our institution must show care and compassion to the victims as to prevent so that the investigation and the proceeding would actually exhaust the victims and add to their mental burden. A friendly support institution that allow victims to receive timely assistance and encourage the victims to report to the police. On Dr. Chan's motion, the WHO 15 years ago in 2003 they have raises concern on this topic. In the WHO report on the guidelines on medical legal care for victims of sexual violence in a lot of countries and regions, for the victims of sexual violence victims, they're providing the medical and social service on a disjointed manner. WHO takes the view that such approach is inefficient, redundant, and would place the burden on these victims. Currently in the US, Australia, UK, Taiwan, they have set up dedicated one-stop crisis support center. Take the UK, for example, they call them Sexual Assault Referral Center. In 2013, through legislation, this bill is called Health and Social Care Act, which empowered the National Health Service, just one agency, to be responsible for the coordination of these the operations and the crisis centers. Instead of the Hong Kong, they have a different bureaus responsible for their respective ambit in crisis management. In 2014, in UK has opened 48 such crisis center. Looking back at Hong Kong, our medical services, our social worker services, and the law enforcement agencies are rather advanced and professional and progressive in Asia. I hope the administration can duly consider Dr. Chan's proposals and the amendments raised by the colleagues, and duly consider the WHO guidelines issued 15 years ago to enhance the medical and legal care and psychological care of sexual violence victims. Looking at other members' amendments, even though my colleague Mr. SHIU is not present, and just now Mr. Yip Kin Yun have discussed Mr. Hsu's amendments. I also noticed that the Ms. Max and Ms. Chun's motion of asking the police to establish dedicated special investigation team for the police as well to enhance internal procedures so as to reduce the need for victims to repeatedly recount the episodes and to spare them on the psychological burden as well to a secondary or repeated traumatization. I will support the amendments. And also support Dr. Fernando Cheung's amendments, especially on enhancing the professional support for abused children, so the expedited provision of support services, and to mitigate the psychological trauma to children, and to provide a timely help for the children is the obligation for children to protect children. In Hong Kong, where we have a low birth rate, our fertility rate is only at 1.1, which is way behind a lot of advanced economies. The health development of children and is an inescapable duty for the society to our future generations. We need to offer more protection for the children. I heard from other colleagues that on the sexual violence victims and the Me Too movement, and for sexual violence and those suffering from sexual assault is not limited to women in this modern society. Men, children, and others will also be subject to abuse by different people, for example, close relative, friends, and teachers, in form of sexual harassment or all kind of abuses. So we cannot overlook the importance. I so submit.
Mr. Ao Nok Hin, Dr. Law, and Assistant Director Pang, we know each other for a long time. Well, I think it takes more than your department and your bureau to answer the needs as stated in Dr. Pierre CHAN's motion. I think the Food and Health Bureau should also contribute to the solution. I'm not sure whether you can coordinate among yourselves so that we can have a specific room within a hospital to take care of the victims of sexual violence. Let me sort of come to the question asked by the Secretary in his opening remarks. I hope he will do so in his reply speech. What do you mean by a one-stop service center? Is it a case-based service, or are you talking about the physical location? Just now, when you gave a reply to Dr. Chan's opening remarks, and then on the 27th of June, the Bureau also answered Dr. Chan's question. You said that one-stop service center isn't just about the location. What is meant is that it is hoped that the services needed, like medical, forensic, police, support, etc., should take place at the same time, same place. Now, even if the victim has only used the one service out of the several, it is still being regarded of having benefited from the one-stop service. So it's more about service than location in the eyes of the administration. Here we are talking about an integrated service center. You report to the police, you get your injuries examined, you get treatment, etc. So there's no need to wait for a long time, and we should be focusing on the needs of the victims so that the victims will be spared the trouble of having to go to different places. I haven't had the experience of helping victims of sexual violence, but I did come across a particular case in summer. At the time, it was a child abuse case. I had to accompany the child as well as the grandmother to go to Queen Mary Hospital. it took up a day's time. My experience on that day told me that there are many problems in the system. First of all, the social worker started with taking away the child because the mother was suspected of having abused the child. So at QMH, the curtain was drawn, and then the child was left alone to give an account of the injury. The police came. The child told the story again, and when the doctor came, the child told the story the third time. So maybe we should let the child and the grandmother stay together, and then the professionals come, and then they only give an account once. That would have simplified the whole thing. I think the child would like to stay with the grandmother, but then the child was forced to stay at the hospital to have the injuries examined. Now, in fact, it was found out that it wasn't a case of child abuse. In fact, the child was trying to stop the mother from committing suicide. Well, in fact, the child didn't make any did anything wrong. He was asked to stay at the hospital to have a medical examination. Well, it is a very sort of special case, and if you're interested, I would like to share with you my observation. Well, I see major problems with the system. And then according to Rain Lily, 17 hospitals have a dedicated room for this purpose, but in some cases it's a storeroom or it's the common room for doctors. In other words, there would be other people coming in and out. That's not what we have got in mind. We need a dedicated room to help the victims. For child abuse, I'm sure we know more about that. But then let me turn to sexual offense. For 17 years, Rain Lily has helped 3,000 plus cases. Many of them were rape cases, but then according to the police, there were only 206. In other words, the official figures do not tally with the number of cases received by Rain Lily. And from what they told us, it seems that there are many restrictions in the police system. You need to be given contraceptives, and currently the health service as well as the legal enforcement are two separate systems. Should you make a report first, or should you be examined first? Probably you have to go to two places, one after another. And in some cases, the system is so foolish that the police station would ask you to go to a hospital, make a report to the policeman there, and then with the note there, you go back to the police station. Or sometimes a victim is asked to go to another district, another region to report the matter. So it is complicating things. And then Secretary Dr. Ma from Rain Lily told us that, in fact, for the A&E department, I think it has the capability of taking evidence instead of having to wait for the forensic pathologist. I think the doctor can help in examination and treatment, and then the social worker can provide counseling. If we do start to change it, then it means that we are not overcoming the gaps and loopholes in the system. I do hope that both the Bureau as well as the SWD can work together with the Food and Health Bureau as well as the Security Bureau to resolve the problems. Thank you. Mr. Tommy Cheung.